may I know your specialty of interest? Whether it is GP, whether it is physician, surgeon, OBGYN, can you all type that as well to understand what is your dream specialty, or which is the one which you are really love to pursue for the rest of your medical career? Okay, fantastic. OBG surgery, pediatric surgery, surgeon, public health, interesting. Anesthesiology, very good. Okay, midwife, passionate, fantastic. Midwives are our pillars. OBGYN, orthopedics, internal medicine, surgeon. Okay, all specialty people are here. That's really fantastic. Biostats, that's again one of the topics which is very important for research. Yes, epidemiology is important. Ophthalmology, yes, fantastic. So we have got people here with different interests. That is really fantastic. Pulmonologist, fantastic. So now, how many of you can you just probably put the dream destination where do you want to work? UK, US, Australia, Uganda. That itself is, see, our home country is always fantastic. CPD link, we have already provided Dr. Odong the support team. They would be able to tell you, give you, and definitely this is after the session. Infectious disease, Ireland, Uganda, fantastic. Australia, Congo, very good. Urologist, okay. Australia, yes. Which is a country of your destination, US or Australia, okay. Canada, fine. UK, okay. Uganda, fantastic. Okay, fine. Okay, guys, there are a lot of people. Perfect. Lot of people who would want to work in Uganda. I've got people who want to work in UK, Canada, Australia, so on and so forth. South Korea, interesting. Okay, so remember, different countries have got different licensing exams. If, for example, if you want to focus on US, if US is your dream, US and Canada, then you must focus on MLE only, USMLE only. And if you want to work in UK only, you could focus on all these Royal College memberships. You can do PLAB, but again, whether you want to enter into training job or non-training job, you need to be thinking in. If you want to go to Australia, the best bet would be the AMC, which is Australian Medical Council one. And of course, for all this, you need the language training. So whichever the specialty you choose, we have a structured pathways for the same. Of course, you all need to get in touch with the team to help you to understand, because I'm left with only 40 minutes to help all of you to understand the framework. Okay, so only thing which we have always believed in is hand holding, and make sure that like you would achieve whatever you think of. Okay, now fellowships which, okay, Dr. David, you have to mute yourself. If anybody has got doubts, you can always we can always take it towards the end Q&A, or you can meanwhile put it in the chat box. I'm happy to answer as we are moving forward. As I mentioned to you, the specialities, apart from this, what are the fellowships and how are we going to do? Because if you have finished your post MBBS, you have done your MBBS, you're a registered doctor who is working in Uganda, you are not able to spend the time and energy which you have got for the Royal College, and you want to work in Uganda, or if you want to expertise in that dream specialty, you can go for fellowships that build a subspecialty depth. Basically, we will help you to understand the theoretical knowledge. That's extremely important before you go and practice yourself with the patients. And then we make sure that you have a hand holding with the clinical practice, basic clinical skills according to the privilege which you get, so that it is easy for you to practice. And it is purely the mentor guided sessions, mentor guided activities which will help you to understand. Of course, there are mock exams and they are accreditation aligned. Okay. Now, We already have got a live pilot project of fellowship in reproductive medicine at Sally International Hospital. I would request Dr. Paul to talk about how we have been doing, what is the blended format all about, and how you're planning to help the Ugandan doctors. Dr. Paul, over to you for this slide. Dr. Paul, I hope and believe you are around.
Much, Dr. Somia.
Hello, hi. Yes, please.
Good evening, fellow, this evening. Yeah, actually, the blended form of education will work for you in such a way that there are things that you study in all those courses that he has mentioned, but which will not presence, okay? There are courses which you again, okay? So of this information again online, and then the other part is done clinically. Or if you are preparing for an exam, definitely you'll have an easy way to go through it, because all you need is to be connected such that you get this information live with good mentors who are ready to assist you where you're having challenges. Many people, I saw when we are indicating where people want to work, I saw few people who like to work in Uganda than all the other countries combined. So it is very evident, and everybody knows that the situation in our country right now is not the best working environment for medical doctors. So it is going to be a bridge that is going to help you to connect between your dreams and your realities, and also realize what you have done in theory and what you are able to do practically at the bedside of the patient, because that is where your skills are mainly going to count most, where your abilities are going to be measured, not so much of what you've learned in the books, but how you can be able to put your skills into real patient practice care. Thank you.
Fantastic. Dr. Paul, thank you so much for that. And Dr. Paul is actually helping us to build the bridges and to burn the bridges so that we can help Ugandan doctors to achieve this feat, because I'm sure because he has done in India, so he is somebody who is very expertise with the embryology and the ERT part of it. And Dr. Sally itself, the one who has actually started off IVF in the first IVF baby in Uganda. So if you get an opportunity to learn from Professor Sally, then nothing like that. So this is one such project which we have started off, which is doing really good, and we have a lot of enrollments which are actually able to help a lot of people to achieve their dream of reproductive medicine. And upskilling. See, one thing is upskilling yourself and to develop the skill. And the second thing is continuous CPD or CME points. I think everybody here is asking for registration for the CPD link. Okay, I think Dr. Henry has put it here. So it's how important it is for our continued medical education to prove ourselves that you are updated and so on and so forth. So upskilling not only brings the knowledge, it makes you updated and get your CPD points going on. And of course, remember, more than the CPD points, the most important point is all about treating your patients safe, making sure you are legally correct and keeping the documentation correct, and to know when you can treat, when you need to refer. This is extremely important whichever the part of the globe you work in. And of course, you have got expert mentorship, as well as you would be able to get this through one click away. Okay. Fellowship or PGD. I think Dr. Susan is asking, I want to do a post MBBS. Doctor, I'm going to take the questions later because I saw I'm answering you. There are a lot of doctors who would want to do MRCOG and fellowship in reproductive medicine. There are a lot of doctors who are only doing the reproductive medicine. If you can do MRCOG with reproductive medicine, then it is like a super leap for you to practice anywhere in the globe. So think about it, get in touch, we would be happy to help. As I was trying to mention, there are a lot of course providers, there are a lot of online platforms which you can see every day in Facebook, Instagram, TikTok, Twitter, LinkedIn. But which one to choose? Please remember quality assured programs which can provide you the certifications which would be valid for your clinical practice is the one which you need to choose. So I can talk about us. Why study medic? Because all our programs have been reviewed, rigorously assessed, because British Accreditation Council is a 5 days face-to-face auditing. They come from here. We had Miss Linda Rose who had traveled from UK 5 days. She had to go through all the documents. She had independent query for our students, for our mentors, and finally she was convinced, and then she gave us the back accreditation. Unlike many people feel, these accreditations you would get if you pay the money. There could be a lot of organization who will be doing that, but you wouldn't be getting back accreditations. You wouldn't be getting a CPD accreditations unless you have got a proper framework for the UK or the US accreditations. As well as I mentioned, we are the only official partners for European board. So all other accreditations speak volumes of our quality, and the most important thing is we have mentors globally. It is not one place. We have got a lot of places, and people who I could see a lot of surgeons who are here. All our courses are accredited by Royal College of Surgeons of Edinburgh. So it can, you might understand what is the width and breadth of the quality which we want to carry for every other person. So at the journey, I wanted you guys to go through the journey of an Ugandan doctor from Uganda to global career, how you can move. See, first of all, you need to decide your path. For that, you need to decide the specialty you want to be in. Identify the exam, whether it is Royal College, upskilling, special arts, you want to do a fellowship program, whatever. You can get in touch. We would be very, very happy to help you to decide this counseling call as well. Mentorship guided programs for you to prepare whatever you choose and to become successful. Once your globally recognized exams you clear and you add on the specialities, then you would be practicing and leading either in Uganda or anywhere outside. What I would want to say that you would never be left alone in this journey. You are always, always, always handheld by a group of mentors, expertise who would be able to help you, because we all have walked this path, right? We all have walked this path. Okay. So we know what are the difficulties, irrespective of the nationality you come from. Okay, if Dr. Paul is there, I just wanted him to take you through the clinical excellence in practice, how we are going to build in the bedside clinical postings in Sally. Yes, Dr. Paul, are you there?
Yes, I'm here.
Yes, please.
Yes, like I already said, there's quite a big difference between what we learn in school, either in medical school or any other form of training, what we learn in theory and what is able to be applied. And the patient will not really benefit from the type of grade that is on your transcript, other than a procedure that you can do to save their life when they're in danger. So the key thing where knowledge meets the bedside, okay? Passing an exam is at the beginning, but then excelling clinically in how much you can help the patient using evidence-based knowledge and mentorship, okay, that you have received that can help you to bridge these two things. Yeah, what you learned and what you are able to apply, okay? So we are training you from evidence-based practice, okay, using the clinical skills that have been proven, okay? And then we put the patient at the center of the training. Yeah, how is the patient benefiting from the procedure going to be done, okay? How are we able to communicate, and how is the patient safety taken care of, okay? And you are not working in isolation, but with our mentorship team to share, okay, the decisions that you are going to be making with when you are handling patients. Then at the end of it all, you are trying to, or during the process, you audit and reflect, okay, how much have I done and what has the patient benefited from what I have done? And carrying a textbook and answering questions. The exams blah, blah, to, for example, you have OSCEs where you have cases that you are going to be tested, mainly done, I think, when you have crossed over. With these exams, where do I have training from? Where do I? Some have been traveling to South Africa to just for exam to afford to answer the questions. So that's what Study Medic is trying to bridge you, such that you don't have to register for an exam over and over when you are failing and spending your money. In most cases, you will even just give up and say, no, this is not for me. Okay? But once you are well prepared for the exam, then you are able to sit for the exam only once. Okay? When you go. Once you get good mentorship, okay, when you get someone who is translating whatever theory that is coming into practice and competence, then helping the patients here in Uganda and even practice on international scale. Soumya. Dr. Soumya, are you
Yes,
able to hear
yes,
me?
yes, yes.
Yes, you can
Okay.
continue.
Yeah, thank you, Dr. Paul. See, what we are trying to build is, see, online platforms help you to get the knowledge, and probably we might, post COVID, we can do everything online. But practicing on the real patients is something which we all need to be doing, but under the supervision, under the hand holding, probably assessments, logging the activities through the logbooks. That is what this fellowship at Sally, which we are trying to do. Okay, so you are monitored, supervised, assessed, assisted, and observed as well. So I think we were actually we got help of Dr. Paul and so many other people to get the fantastic partnership with Ugandan Medical Association. Basically, we are trying to help doctors in Uganda, as I mentioned to you, the structured framework and making sure that they achieve their dream to be the best. That's what whole of our vision for Uganda and for the Africa as such, because the doctors and the healthcare professionals are super skilled. What they don't add on to there is degrees in front of them. And that is what we are actually trying to bridge the gap of academics, certification, clinical skills so that you guys can be the best versions in your career. You can earn better, you can learn better, and you can perform better. And of course, you can be placed in better places, the place of your choice. I think this is what we want. If at all, if you don't want to leave Uganda, as some of you said, we would be able to help you to reach global standard. If you definitely want to relocate, again, you are already there for the global standard, so it is quite easier. So we believe that every person whoever thinks of achieving something would be able to do this with a lot of ease, because if you get a proper structure framework with the hand holding, with a proper mentorship, nothing is difficult. I think that's what I wanted to bring it across to all of you, the belief that what you think is doable. Of course, there are a lot of ways of doing it, and there are lots and lots of hurdles you might come across, but don't worry, you are not alone. We are here to help you. Okay. Yes, I think that finishes what I wanted to speak about. So, yes, over to you, Dr. Rugras.
Thank you so much, Dr. Nomia. This has been very detailed and new. It's very good knowledge for us to have, especially seeing the current status quo of the country and the environment that may not be as favorable for doctors as it was back then. So I have a few questions for both Dr. Somia and Dr. Paul, and then afterwards I'll open up the floor to the members to ask their questions directly. So this is to Dr. Somia. Are these qualifications, oh, maybe it was covered in the presentation, but are the qualifications that are provided by Study Medic recognized in Uganda and also internationally?
See, definitely all these global memberships are recognized everywhere, to be very honest, the Royal College membership. Okay. So that is something which, if somebody wants to go outside India, yes. And if they want to practice in Uganda, yes. Of course, I think every country has got the medical registration process, which they need to be doing. But generally, people who ever do the Royal College membership, they would try to go out. So there are a lot of people in they leave their home country to learn newer skills and then come back as consultants. So that's also a possible route which people can avail for.
Okay, thank you, Doctor. And then this is to Dr. Paul. I've seen when Dr. Somia asked us to list our specialties, our dream specialties, some people did put clinical embryology. So I would like to know, what does the reproductive medicine fellowship at Sally Hospital cover, Dr. Paul?
We have a whole series of courses. There are about 21 units that we are covering in a practice in a period of 1 year, and then followed by 3 months of clinical hands-on experience. So we want to make sure that you could look at our course outline such that you are able, by the time you finish your training program, you are able to have the skills in reproductive medicine. There are a number of courses in them in the subspecialty. You, especially in practical, we want to make sure that a person who has finished the fellowship can be embryo culture, great. That is you being able to use time-lapse imaging.
I think Dr. Paul has got network issues. Is he audible clearly to all of you? Because I think it's breaking in between.
So
Actually,
like,
I want to address that. Dr. Paul, you're having a bit of breakage on your end, so your submission keeps being
yes,
interrupted.
maybe it's it should be my network because I'm home. Yes, but I was just to appreciate, okay, especially degree programs. Yeah, those as a subspecialty.
Okay, just to summarize, what Dr. Paul was trying to mention was in SALI, you would learn from the basic anatomy, physiology to the clinical skills like from ultrasound monitoring to embryo pickups to ovulation, induction protocols, which are extremely important, right? So, all those skills you would be learning from IUI to how to prepare the semen analysis, semen preparation, so on and so forth, you would be able to learn based on the program you have opted for. Yes, Dr.
Yeah,
Dorcas.
and yes, and I have two follow-up questions to that. Number one, does one need prior IVF or embryology experience to join? And secondly, is that program specifically aimed at clinicians or embryologists?
See, actually, this one we have designed in such a way that post MBBS anybody can take this fellowship. Okay, but the traction what we have got, because there are two things. One is a diploma, which we are trying
Okay,
to do the basic skills. Yes, Dr.
obstetric
Paul.
and gynecology. Yes, I was saying that for the fellowship specifically, you need a clinical background of obstetric and gynecology before you go for the fellowship in reproductive medicine. But we also have a diploma program, which we have made simpler for people who have, say, MBCHB, people who are bachelors in nursing, and people who have medical laboratory technology, for example. Yes, so that they can do a short bridging course that can help them. Yes, apart from the 1 year reproductive medicine program for the obs and gynecologists.
Okay, thank you so much, Dr. Paul. And now to Dr. Somia. I would like to know the payment plan, yeah, for those who will take on the study medic pathways. How much does it cost? And is there a member rate for those who are members of UMA? Is there
Yeah, true.
essentially a payment plan for them?
Yeah, so the thing is, at StudyMedic, we always believe no matter what it is, people shouldn't be taken away from their uh, chance of studies purely because of the money thing. Of course, uh, if they are coming through UMA, they have got a different offers where they get the maximum deductions and so on and so forth. And of course, we have, based on the economic status of the countries, we have banded into the countries where they get at the least price possible for them, so that they would be able to study and go forward. So if anybody, whoever is interested, they can get in touch and the team would be able to help, because we have got at subsidiary rates, we give the maximum discount for the Ugandan doctors and if they come through the UMA. Otherwise also we do that. Yeah.
Oh, thank you. And then once again for Dr. Somia, which exam should I start with? for the specialty of my choice. We have seen in the comments people putting surgery, obstetrics,
Yeah.
radiology, psychiatry. So how do I go about the exam that I should start
Exactly.
with?
See, there is no one answer for all of this, Dr. Dorcas, because if you are already working in that field, then Royal College membership is the best for you because you've already got an experience, you know what you want to, and you might have got that, the inclination towards to finish because these Royal College memberships are time tested and they take a lot of your time and energy. But if you're somebody who's a fresher, who just finished MBBS and they are doing a GP practice, but they always wanted to do something in their specialty, then fellowship is their choice. However, it can be interchanged. Fresh now we get a lot of fresh graduates to finish their theory part of Royal College and work with us in the clinical observerships, the internships, the externship, and they give the Royal College program. So there is no one answer for this, but definitely fellowships are the easy go if they don't have time, if they want to finish quicker. But if they are already practicing, then global memberships, licensing exams like Royal College would be the best bet.
Okay, just to make sure that I've understood what you've said, the fellowship program pathway for Royal College and the study medic is open to fresh MBCHP graduates or those who are still doing a general practice. Is that right? And then furthermore, for those who are interested in practicing, let's say in the US, can still go ahead and do the Royal College fellowship.
See, if they want to do in US, then they have to take MLE. So that's first. There are few things, Dr. Dorcas. One, which is the country you want to settle? Second, what is the experience you've got? Third, what is your dream specialty, whether you're looking at specialty or super specialty? Fourth, what is the time frame you're looking at? Fifth, what is the time, energy, money you can spend on? So if you answer these checklists, they would be able to get an answer. But for everybody, different categories, we have got different courses. I've briefed very few, but we work around 33 plus streams. Okay.
All right. Thank you so much, Dr. Somia. So for Dr. Paul, I'm still on the fellowship and the clinical aspect, the program that is being run at Sally Hospital, I think. So is the rotation specifically at Sally, or there are times where you'll have to go outside for the other rotations? Is there a need for preparing travel documents? Yeah.
Yeah, for now, all our work will be done here in Kampala. Yeah, so maybe those who are traveling, who are supposed to join from other countries, the requirements may be different. A person who is coming in from India might have a visa requirement that is different from someone who is in the East African community. Yeah, so we are basically based, Kampala based. Although Dr. Sally has other hospitals in Tanzania and Zambia, we have not stretched that far to make sure that we do our programs in those hospitals. But we are working mainly with the hospitals in Uganda. That is Sally International Hospital and perhaps with Women Hospital International. Perhaps what Dr. Somia didn't mention, maybe you did not remember, there's a basic, because we are talking about the requirements for joining in the programs, especially for those who are going to work out. You need to do language tests, yeah, for almost most countries. Yeah, whether you're going to Canada, to UK, to US, yeah, they will require you to do the basic IELTS exams. And they specify them, whether you are doing a diploma course or you are doing a master's degree, or whichever way, that they always want that as a basic requirement as well. Thank you.
Thank you for that, Doctor. Thank you, Dr. Paul. So I have two more questions for Dr. Somia.
Yes, please.
You mentioned that there's a payment plan, can even subsidiaries for those who are part of UMA. So in case I attempt to do to follow the pathway but unfortunately I failed the first time, yeah? Is there any support? Do I have to pay again when I'm doing my second attempt, or there's a way that I can be helped?
See, you would be helped, but you still need to pay the nominal charges because all these LMS, the website hosting, it costs some money for the operational end. So that much money we would be charging, but it would be nominal.
Okay, and then secondly, could you please elaborate on the benefits that being a member of UMA has in relation to accessing the study medic opportunities?
Okay. So because we are closely liaised with UMA, the main thing which we want to do is upskill every doctor who is associated with Ugandan Medical Association. So the benefits would be they can actually get a free counseling call. They can actually get the free access to the libraries which we have got. And if they are doing their exams, they can get free crash courses near the exam, and they could get the free benefit of talking to the mentor when their exams are nearby. And there will be a lot of counseling calls which free of cost for them to understand which course to choose, which specialty to choose, how to go on the clinical rotations, and so on and so forth. And also, going forward, we are thinking of providing the CV building and all in the coming days. Not as of now, e-portfolio building and CV building in the coming months ahead, based on the requirements.
And this is my last question to Dr. Somia. I've realized some of the questions I prepared have been answered in the course of the presentation. So is this program not going to increase the rate of brain drain from Uganda?
See, it's not that, see, even in India, there are almost all the specialists do these Royal College programs. But people who relocate outside India are few. Because what happens throughout the process, once they learn this evidence based skills, once the people start coming to them, they wouldn't want to relocate from their home country. So I think it is better to get better evidence based physicians or the doctors for Ugandan patients rather than thinking that, okay, if we train them, then they're going to go out. Anyways, some proportion of doctors are, anyways, they are going to go out, but they would come back when they want. But the patients in Uganda should be treated holistically, evidence based. So, for that, this upgrading, upskilling is must. So, we are trying to help people to upgrade and upskill so that they need not leave their home countries. They can still be at the comfort of the home and do the best of the services to the patients of their home country. But we are all different. People would still want to leave the countries, and I think that should be left to them. But I do not really encourage to leave their home countries, because I worked across so many countries and I want to work in my home country, but that takes some years to understand. So that, let them go. I feel they should be set free so that they can decide.
Thank you, Dr. Somia, and thank you, Dr. Paul. Those have been the questions on my end. And at this point, I would like to open the floor. Members in attendance, please feel free to utilize the chat or unmute and ask any questions directly to either one of our presenters. Thank you.
Good evening.
Yes, hi, good evening, Jennifer.
Yes, I'm one of the fellows who have enrolled for the fellowship in reproductive medicine. I want to thank you, Dr. Somia, for bringing services closer to us, educating us at a subsidized rate, with the passion that you have to see us succeed while not paying exorbitantly. Is it possible to consider incorporating the requirement for one to be registered by Uganda Medical and Dental Practitioners Council after getting this fellowship certificate? For example, our Registrar of Uganda Medical and Dental Practitioners Council keeps emphasizing that you must have an on-site mentorship with hands-on for at least 9 months for you to be registered. Is it possible, even if like to increase the price a little bit and have us there for this required time, and then we get cleared by the medical council? Yes, the knowledge is very good, but also the certification is another when you're recognized in case you get into your battle and then you are registered, it's easier. Thank you. But I would like to encourage whoever wants to join the program. It's very good. It's very intensive. I have not read for 3 days, so I'm now here busy trying to catch up because every single day there is something to read, and it's the knowledge we are gaining is much. We are only emphasizing on the hands-on that is required as fellowship training in Uganda. Thank you.
Thank you, Jennifer. You have always been very kind in the study groups as well. So that's a very kind feedback. Thank you so much. And yes, regarding the accreditation, you know that Dr. Paul is working very closely and we should be able to come out with a positive answer. And definitely, if that demands to extend it hands-on, we should be able to do it, because by the end of it, you guys should be able to practice. I'm sure Dr. Paul and the team is working relentlessly for that. Thank you. Any other queries from anyone, Dr. Dakas?
There is a question that I've seen in the chat from Fetaru. How can we get opportunities for clinical
Yeah,
externships?
I have
Cindy,
answered them. I have answered him because it depends on what specialty he's looking at, which is the place to get in touch so that we would be able to help. Because we've got a lot of associations, so we should be able to help them.
Yes, thank you, Doctor. So I don't know if I should believe that the presentation was detailed enough for everyone to understand and be satisfied with it.
Thank you. Either people have understood everything or they haven't understood anything. But because of the queries, I still love to believe that I was clear enough. Thank you for this opportunity, Dr. Rakas and the UMA, and all of you wonderful people who have spent some time with us. And
All right, let's
this
jump
has given
right in.
you a direction to work around. Thank you so much, and we would be happy to help.
Thank you to Doctor. You have really brought this close to us. And I've been seeing a contact being shared in the chat for those who have inquiries. Please feel free to reach out. The doctors are here for you. I'm sure they're very welcoming and they are looking forward to having you join their pathways. So at this juncture, I would like to adjourn the session. Thank you all for attending. It's
Thank you.
evening program, but the turn up. So feel free to leave at will and have a good evening.
Thank you. Thank you, everyone.
Everyone for attending, and a good night.
Thank you so much.
Recording stopped.
Dive into the global education opportunity and break down what we call the 4-pillar framework. After that, all right, let's jump right in. A massive welcome to all the incredible doctors and medical pros tuning in to the UMAD live broadcast today. We are absolutely thrilled you're here with us for this special July 1st explainer. This actually officially kicks off our brand new monthly CPD and CME series. And listen, today's topic, it's a real game changer. Advancing clinical excellence in Uganda through global medical education. Over the next few minutes, we're going to unpack exactly how we are building globally mobile, world-class doctors across literally every single specialty, and doing it right here at home. So here's a quick look at our roadmap for today. We'll do a quick welcome to UMA TV Live, dive into the global education opportunity, and break down what we call the four-pillar framework. After that, we'll see what clinical excellence looks like in actual practice, and then wrap the whole thing up with the UMA partnership vision. All right, Section 1. Welcome to UMAT V Live. Let's get to know the amazing folks steering the ship today. To guide today's broader conversation, we have an absolute powerhouse of expertise with us. First up, our fantastic moderator, intern Dr. Dorcas Ahonesa Wamimbi from ARIA Regional Referral Hospital. And joining her to share some really deep insights are our expert presenters. We have Study Medic CEO and co-founder Dr. Somya N.S., alongside Study Medic mentor and academic registrar at Sali International School of Fertility Medicine, Dr. Paul Kibenje. It's just a brilliant combination of global educational vision hitting local clinical leadership. Okay, moving right along to Section 2, the global education opportunity. Let's talk about why this matters right now. You know, for the longest time, advancing your medical education kind of meant relying on this really fragmented self-study, dealing with totally uncertain exam outcomes, or going to these isolated one-off training events. Well, we are pushing a massive shift away from that outdated model. We're talking about transitioning to structured, mentor-led pathways that actually have proven success, completely fueled by continuous accredited CME. We're essentially swapping out that old isolation for robust, structured support. But here is the absolute crucial point. Uganda's doctors, you are already clinically strong. The gap here is rarely, if ever, a lack of ability. It's simply a lack of structured access to globally benchmarked qualifications. So by opening up this access, we're empowering capable doctors to hit global standards without having to pack up and leave the country. We keep our local talent, we reduce brain drain, and we make sure the absolute latest evidence-based guidelines reach the bedside right here at home. Which brings us to Section 3, the four-pillar framework. This is how we actually take things from local to global. So this framework is basically designed to take a doctor from a rock-solid foundation of local excellence straight to global practice. And it relies on four seamlessly connected pillars: qualify, specialize, upskill, and certify. Think of them as a complete, unbroken journey that ensures you're supported at literally every single stage of your career. Let's break down that first pillar, qualify. This is all about cracking those notoriously rigorous global membership and licensing exams. But, you weren't doing it alone in the dark. This is achieved through highly structured, mentor-led prep. We're talking comprehensive question banks, tough mock exams that really test you, and focused revision intensives. And honestly, the sheer scope of this first pillar is mind-blowing. I mean, whether your focus is obstetrics with the MRCOG, medicine with MRCP, surgery with MRCS, or maybe you're eyeing international licensing like the PLAB or the USMLE, there is a dedicated, structured pathway built just for you. A globally recognized qualification is totally within your reach no matter what your specific clinical focus is. Right, so once you've qualified, we step into Pillar 2, Specialize. Because passing an exam is fantastic, for sure, but doctors also need recognized subspecialty competence. These fellowships give you that structured, mentor-guided subspecialty depth, and they are fully aligned with international CME and accreditation frameworks. This pillar practically takes your exam success and translates it into demonstrable, recognized expertise that hospitals, employers, and most importantly, your patients can actually trust. Then we hit Pillar 3, which is upskill. Why? Because clinical excellence isn't a one-and-done deal. It has to be maintained. We keep doctors at the top of their game through continuous CPD and CME, all backed by a seriously powerful mentorship network of actual practicing specialists. And by using a modern blended learning platform, so mixing on-demand modules with live teaching, you can get world-class professional development from literally anywhere in Uganda. Finally, we wrap up the framework with Pillar 4, Certify. At the end of the day, recognition is what makes a qualification truly portable, right? Highly respected accreditations. We're talking the British Accreditation Council, the Royal College of Surgeons of Edinburgh. These ensure that the programs you're completing are trusted, quality assured, and recognized by employers across the globe. All right, Section 4, clinical excellence in practice. Let's see what this looks like when we turn theory into actual bedside care. Because right now, this is not just theory. There is a hugely exciting live pilot in reproductive medicine happening as we speak at Sally Hospital. This Fellowship of Stud Medic program is proudly being led by Dr. Paul Kibenje, and it's taking that absolutely vital step of dragging theoretical knowledge right to the bedside. Just to give you a sense of what this looks like on the ground, the pilot uses a blended one-year format. It mixes rigorous online modules with a very intense 3-month hands-on rotation. The doctors enrolled in this right now are getting deep into the weeds of clinical embryology, ART, IVF, ICSI, not to mention vital lab safety and quality control standards. It's a living, breathing proof of concept showing a repeatable template for building homegrown subspecialists under continuous mentor supervision. And that brings us to a really core truth, which I'll quote here. Passing an exam is the start. Clinical excellence is the daily discipline of turning that knowledge into safe, evidence-based, patient-centered care. I mean, that hits the nail on the head, right? That is the ultimate goal here. This framework transforms your test knowledge into audited bedside competence using mentorship as the bridge. Moving on to Section 5, the UMA Partnership Vision. Let's talk about how this actually empowers you. This whole vision, it's made possible by an incredible synergy. We are combining the trusted national reach and the CPD mandate of the Uganda Medical Association directly with StudyMedic's proven global education framework and their expert mentors. We are quite literally bridging local Ugandan medical talent directly with global medical standards. So, to just summarize the very tangible so what benefits this practical collaboration delivers to the Ugandan medical workforce right here at home, you get access to regular, accredited monthly CME and CPD sessions, just like this one you're in today. You get structured exam preparation pathways across dozens of specialties. You get local access to recognized subspecialty fellowships, and you get plugged directly into a massive global mentorship network, the whole shebang. Which leaves us with a final, slightly provocative question for you to chew on as we wrap up this explainer. How will you use this 4-pillar framework to reach global medical standards and elevate patient care without having to leave Uganda? The opportunity is right here, the pathways are already built, and the mentorship is waiting for you. Keep that question in the back of your mind as you get ready to dive deeply into the detailed CME session and panel discussion that is coming up right now on Yuma TV. Enjoy the session, everyone.